Um, so I think my presentation actually is going to build on what we've just started discussing about the importance of relationships and Siobhan's question about adverse childhood experiences and their impact. I'll talk about violence prevention, preventing violence against children, and how that is one of the ways of protecting and improving young people's mental health. Other areas that I will be working on at Wolfson Centre will be focusing on school-based interventions, the School Health Research Network that we heard about from Chris, and also together with Dr. Lucy Riglin, promoting open science and supporting learning about quantitative methods and quantitative inference across the Wolfson Centre work streams. But today I'd like to tell you more about violence prevention, and we'll start with a definition first in the best academic traditions by asking you what, in your opinion, violence is, how you would define that. There is a Mentimeter code there, same as in Beck's slide. If you can go to menti.com and enter this code here, I hope that works. Then please go ahead and if things come to mind, pop them into the chat or the Q&A. Oh, there you go. Causing harm. And that's really helpful. And glad the code is working. Yeah, so you will see in the definition that's widely used, which is definition introduced by the World Health Organization, who have been doing a lot of work in this area. It is all about causing harm or high likelihood of causing psychological or other harm, physical harm, maldevelopment, deprivation to someone, an individual, a group, or even yourself by using force or power. And specifically when it comes to violence against children, we know from several decades of research that depending on child's age and other factors, different forms of violence may be experienced across childhood. So for instance, for younger children, violence in the home is much more common, whereas as children get older, start interacting with peers, issues like bullying, youth violence, intimate partner violence become more important as well. A lot of my own work and what I'll talk about today has focused on child maltreatment and particularly the role of family and caregivers in preventing that. So the reason we're talking about violence today, as we've already mentioned, it is an important risk factor for mental health, lots of negative mental health outcomes across the life course, including anxiety and depression, which are the focus of work at Wolfson, but also both directly through mental health and risk-taking and indirectly through mental health and risk-taking and directly through injury. Violence against children can affect physical health, including non-communicable diseases such as cancer and diabetes, and really even impact somebody's health and life expectancy. So it can have really fundamental impacts, but it's also a violation of human rights. So the UN Convention on the Rights of the Child, which is actually now the most widely ratified human rights treaty in human history, protects the rights of the child against violence. And we also know that violence against children is very common. So depending on the definition you use, of course, the numbers vary, but using a fairly wide definition, if we look at past year exposure, actually nearly half of the world's children, 1 billion children, have been exposed to some type of violence based on modeling studies. And then if we look at more severe types of violence, homicide being the most severe one, we also see that numbers are quite substantial. So almost 100,000 children in 2012, which is the latest estimate that I'm aware of. So we know it's a massive issue, and we also know that it affects countries and population groups disproportionately. So first of all, 90% of the world's children live in low and middle income countries. So a lot of the world's children are there. And also some low and middle income countries, like South Africa, for example, where a lot of my work has been based, also experience disproportionately high burden of violence against the children and also violence in general. And Bex has very kindly posted the code for this next question, which is about what, in your opinion, can help prevent or reduce violence against children. So any ideas on policies and programs that you think can be helpful in preventing or reducing violence against children are welcome here. And I'll just give you a moment to enter the code, which is 19232036. So we've got reducing alcohol use, drug use, poverty, early years parenting support, yeah, all great ideas and backed up by a lot of evidence. The framework I'll briefly introduce next, and thank you very much for this additions addressing poverty, is called INSPIRE. And that's seven pillars that have been developed based on evidence we have about programs and policies found in research studies as effective in reducing violence against children. And you'll see it touches on a lot of themes that you have come up with. But first, I'll just briefly talk about the public health approach to violence prevention. I think it's been in the news a lot, so many of you may be already familiar with it. And it's really about approaching violence as a public health problem. So we first define it. We talk about what violence is, as we have started doing today, and how common it is, different types of violence, and how it affects different population groups. We identify risk and protective factors. And then based on that, based on our understanding of mechanisms of how and why violence happens, we develop and evaluate interventions to prevent it. We then scale up the interventions that work well. We look at how they work at a large scale, which sometimes can be different from small pilots. And then we continue looking at how services are working in practice as they're being delivered. And the cycle goes on as, hopefully with our policies, we also modify some of the problems we are addressing. For instance, rates of violence and responses to violence. There is quite a lot of research on risk factors for violence against children. And like any issue, of course, we can look at it in different levels. So in this model, which is often called the socio-ecological model, here we start with thinking about the individual characteristics. For instance, we know that boys and girls have different risks for different types of violence. We also look at relationships. So we've talked about peers. We also talked about parents. We also look at community factors. So we already mentioned poverty as one of them, institutions and services and others, and then wider societal factors. So social norms, which also are very important for violence and violence prevention. Spanking children is one example of social norms and norm change that we have seen in many countries over the past several decades. So the INSPIRE framework I mentioned builds on all of this. And the 7 pillars it identifies as effective if implemented well, in preventing violence against children is implementation and enforcement of laws. So for instance, banning corporal punishment of children at home and in schools, one example. The promotion of norms and values that don't support violence. Safe environments, so this can be things like creating physical safe spaces, for instance, good lighting in the evening around areas where children play and spend time. Parent and caregiver support, I'll tell you a little bit more about that in a moment, but we already heard in an earlier Mentimeter exercise from somebody about early childhood support. So that type of program which strengthens the families and the caregivers' ability to support the children in their care. Income and economic strengthening, addressing poverty. So programs like social grants, cash transfers have quite a lot of evidence in preventing many types of violence, including violence against children. So trying to remove some of the stresses and burdens. And response and support services, which is addressing violence once it has occurred, supporting survivors of violence, and educational life skills, which is about things like social and emotional learning and helping young people advocate for themselves and build strong relationships to reduce their chances of being exposed to violence. So parenting programs is one of the intervention strategies identified in the INSPIRE guideline, and it is one that I have been working on. So the motivation for that, as we discussed, is that parents, relationship with parents is a really key one for protecting children against violence. We also know that violence can occur at home, for instance, in the context of corporal punishment. Of course, we know that vast majority of caregivers are doing all they can to support children. So parenting programs really are a space for parents to get together, usually in a group of 10, 15, 20 parents, depending on the parenting program, together with a facilitator, and have a space to discuss issues, learn new skills by practicing them and discussing them. And depending on the age of the children that the caregivers have, the topics of parenting programs will vary. So for young children, it will often be about cognitive stimulation, learning about developmentally appropriate expectations, meaning knowing what you can expect the child to be able to do or understand at a given age. And then as children get older, for instance, when they reach adolescence, one of the key age groups for the work of the Wolfson Centre, it's looking at risk-taking and interactions in the community that adolescents have and caregivers' role in supporting them. So final question is, now that you've heard about parenting programs and what they mean, is whether you have any experience with parenting programs for parents and caregivers, either as a participant, as a young person, or as a caregiver, or as a facilitator, perhaps, or as a researcher in any capacity. Yes, we have somebody who has experience. So that's great. You may already know a lot of this, and questions are welcome. Thanks for filling it in. We have somebody who's new to this, so hopefully you may be a little bit more interested now in this type of program, if that's relevant to you or people in your life. Another person with some experience. That's really interesting. Great. So as those of you that have heard about parenting programs may already know, there is quite a substantial evidence base for this type of programs, including from randomized trial, which is a design. I think many of us have now heard, for instance, with the COVID vaccines and previously with other types of medical studies, that's also used for evaluating social interventions, when we randomly, sort of by a flip of a coin, allocate people into two groups or more to receive and not receive an intervention, and look at the difference between the groups. So then once we have a number of randomized trials, we can actually do a systematic review, looking at all the studies that have examined this question and pull them together to see what we've learned across the evidence base from individual studies. And from that evidence-based parenting programs, we know that on average, they are effective in reducing child behavior problems, reducing child maltreatment by caregivers, and reducing caregiver depression, among other outcomes. Most of this evidence historically has been from Europe, including many studies conducted in the UK, North America, Australia, but increasingly we're also seeing more studies from other parts of the world, which also suggest that these programs are transferable and can work well in different contexts. There is, of course, also, like in any research area, a lot we're still learning. So one of them is what happens after an evaluation of an intervention. So we found out something works. Let's say we have a new program, we've tested it, but how is it actually implemented in practice after the evaluation? What happens in 1, 2, 3 years, both with the quality of delivery, but also with caregivers and families that have taken part in the program? So how long-lasting the effects of parenting programs are is one of the areas where research is still ongoing. We are also still learning about how intervention delivery and adaptation may vary between different contexts across societies and within societies, and how to disentangle effects caused of different parts of parenting programs, which are often lasting a couple of months and can be relatively costly to deliver. So there is many more areas that are still being explored, but this is a taster. And to give you one example of how we are addressing these questions, over the past year and a half, we've been talking to several providers in Cape Town in South Africa about how they have continued to deliver interventions for young children and adolescents and their caregivers in the context of COVID, and adapting to that, following an evaluation suggesting that the programs were effective. So with this, I'll thank you very much for your time. There is my email here if you have any questions, and also any questions we might be able to answer in the next few minutes are most welcome.
Thank you, Yulia. That was really, really interesting. Have we got any questions from the audience? Give everyone a few moments just to think on it. Okay, so a question here, Yulia. Is there any research that looks at the impact of the content taught on parenting programs versus the experience of the program, e.g. the value of peer support, how people felt connecting with other parents, etc.?
Sivan, this is a superb question. And I don't think I am aware of a lot of research like this. I think there is a few programs that have done a little bit of what we call attention control, where they have offered, for instance, in the context of a randomized trial, parents allocated to not receive the intervention, so the control group, to receive one information session, for example. But that's quite different because that doesn't really create that peer support and these relationships. So I think it's definitely a really important area. And as I mentioned, we don't really know yet how these different components and parts of the program work and which ones of them are really important. One of the things that has been happening a lot, particularly in the context of delivering programs in lower resource settings, has been program delivery by what are often called lay or community facilitators. So facilitators who don't have psychology or medical degrees, but are members of community that have had, let's say, a week of training and maybe did the programs themselves as caregivers. So I think that's a really important area for ongoing research. And certainly when we talk to parents and children, because often children, especially adolescents, also take part in the programs, they talk both about things they've learned from the program, like different tools. So for instance, planning a household routine, but they also talk about relationships that they've built. So I think both of these seem to be really important. And it's one of the areas to explore to see if, for instance, we can make the programs easier to deliver and more accessible by focusing more on relationships and maybe removing some of the content. That's an ongoing area of work that some of my colleagues, for instance, are currently working on factorial trials where you have many different groups and sort of try to isolate the impact of different intervention parts.
Great, thank you, Yulia. Another question from Nikki. Do you think there's scope to develop these parenting supports through schools?
Yes, again, an excellent question. I think the answer is certainly yes. I don't think there are many examples of this, but there are some. So for instance, we are currently involved in research in Tanzania, where a parenting program was delivered by teachers and using the existing infrastructure of schools and relationships with caregivers. That had some positive feedback, but certainly needs more rigorous evaluation. There are also examples I'm aware of in the UK. For instance, a triple P program was recently delivered by early childhood setting workers. So I think there is lots of scope. I don't think this has been a very common format of delivering these programs, perhaps for practical reasons and existing burden on school and educational establishment staff. But it's definitely an important area that I think is very promising, particularly, again, in terms of accessibility and scale up.
Great, thank you. And another question from Siobhan. Do you know if levels of violence towards children have gone up or down over recent years?
Yes, excellent questions.
Sorry, Yulia, and are there any reasons why it may have gone up or down?
Yes, as always, the researcher answer is it depends, and depends where you look, which setting. And of course, as often is a challenge with longitudinal research, when we try to look over decades, is that things haven't necessarily been measured in the same way or measured well a long time ago. So often when we observe changes, we are not sure what to attribute them to, if it's genuine change or change in measurement. In the UK, there is some really excellent work by Dr. Michelle Degli-Esposti that has actually pulled together rates of violence, and in particular violence against children, over several decades, finding that they have generally been coming down in the UK. But I don't think there is comparable data available in most parts of the world. And certainly things may be different looking within a few years and at a specific type of violence versus these longer term trends. So in terms of the reasons, specifically as far as I'm aware for this research in the UK, and also in the US, where something similar has been found, there is a number of potential reasons that have been suggested. They include increasing standards of living on average. And they also include changing societal norms. So for instance, we already mentioned spanking. Norms have also been changing around gender-based violence in many societies. And also there is lots of other hypotheses. Some may be very unexpected, like removing lead from fuel, because lead has been linked to aggression, or increased access to psychiatric medication. So all kinds of hypotheses are out there. We don't really know for sure, but we certainly do know that factors like poverty and societal norms are important. So I think if we do affect them, we are likely to have at least some influence on population level trends as well. But again, it's an ongoing research area.